what's up everybody? Welcome back to my YouTube channel. Today's topic is definitely one that has been highly requested over on social media. If you've been on Instagram or TikTok, you might have heard of this social media influencer who recently came forward and said that she had a ectopic pregnancy that was located on her C-section incision. This is what's called a C-section scar pregnancy. I'm Dr. Allie, I'm an OBGYN, and we're gonna get into it today. What is a C-section ectopic pregnancy? What does it mean for the pregnancy? And is this influencer being very risky? I mean, to each their own. Obviously, all patients have autonomy to do what they want. And I'll share my thoughts as an OBGYN and hopefully answer your questions. All right, let's just jump into it. So a C-section scar ectopic pregnancy is extremely rare. I definitely want to start with that. We maybe see it in 1 to 3% of all pregnancies in the United States. So again, it's very, very rare. Have I seen it happen? Yes. I think when I was a resident, I had it happen twice. And then when I was in private practice, I saw it once. So yeah, it's pretty rare. A C-section scar pregnancy is referring to a pregnancy that has implanted right over where the C-section scar is. Now, I'm not talking about the scar that's on your skin. That's your skin incision. I'm talking about the scar that's on the uterus. So the pregnancy is inside of the uterus, but instead of the pregnancy attaching somewhere else on the uterus, it is decided to attach right over where that scar tissue is. In order for you to develop a C-section scar pregnancy, you have to have a history of a prior C-section. If you have a pregnancy that is in a C-section scar, this can potentially be very, very, very dangerous for you, the patient, the mother. If it is unrecognized, it could lead to severe fetal and maternal complications. There is a high increased risk of maternal mortality and morbidity because it could lead to things like severe hemorrhage, uterine rupture, and again, death to the mom. And well, the fetus as well. Now, this has been classified into type 1 C-section scar ectopic pregnancy and type 2. This means that the fetus and the placenta have attached abnormally to the uterus because they chose to attach at that scar tissue. And we know that where that scar is on your uterus, that's weakened tissue. So it's not like a normal healthy part of the uterus. It's weak, which is why it can cause a lot of issues. With type 1, and I have notes here because I want to make sure I get it right. But with type 1, when the pregnancy attaches to the scar, it's greater than 3 millimeters between the placenta and bladder or anterior uterine serosa. With type 2, that space between either the outside of the uterus, the bladder, and where the placenta and baby have attached is less than 3 millimeters. So the difference between type 1 and type 2 is how close where the pregnancy attached is to the outside. Meaning, we have our uterus. If you can picture our uterus here, uterus sits here, bladder is pretty close by. So if the space between where we made that incision on the uterus, which typically we do in the lower part of the uterus, which is closer to the bladder. Type 2 means it's closer to the bladder and to the outside of the uterus. Type 1, it's more internal, but still, again, we're talking about 3 millimeters here. Now, is there a difference in the way that we manage a C-section ectopic pregnancy, whether it's type 1 or type 2? Nope, the recommendations from ACOG or the American College of OBGYNs is the same regardless if you have type 1 or type 2. Now let's talk about the pathogenesis, meaning why does this occur in some pregnancies? Now it's unclear because this is pretty rare, but there are some theories. The main theory here is that obviously we know that that scar tissue or where that scar is on the uterus is a weakened part of the uterus. So oftentimes there could be what's called a wedge defect, meaning there's just a little abnormal area there. And for whatever reason, the pregnancy and the fetus are attracted to that area, and that's why they attach there. Oftentimes, this is because there's a low oxygen tension of scar tissue that attracts the implantation of the fertilized oocyte to that area. And it almost just is like an attractive area to attach for the placenta and the placenta villi that are forming early in the first trimester. Why this happens to some women and not to others, to know, again, because the incidence of this is so low, it's so rare. So definitely more research needs to be done, but we don't see it very often. So it's hard to know exactly why this occurs. Now, one of the biggest and scariest complications of an ectopic pregnancy that is in the scar tissue is uterine rupture. Because that area of the uterus is weak, it is more likely to break open because that pregnancy is putting so much tension on that weakened part. If you want to know more about a uterine rupture, I talk about this in great detail on my YouTube video where I go over VBACs, because uterine rupture is a risk of someone who's had a prior C-section and is trying to have a vaginal delivery. Now, the risk of, if it's a normal implanted pregnancy that's not on the scar, the risk of a rupture is like less than 1%. We start talking about when the pregnancy is right on that scar tissue, you're looking at a uterine rupture risk of upwards of 13%. And this usually happens in the first or second trimester, which can be devastating. So if you are someone who was diagnosed with a C-section scar ectopic pregnancy, the chance of you having a full-term delivery is very, very rare. I'm talking about a very small number of patients make it and survive a full-term delivery. I know that sounds really scary, and I'm here to educate and empower, and I'm not one to sugarcoat things. As doctors, we shouldn't just provide all of this hope and positivity all the time, because we need to go over the data and the research, and you need to know that the risk is very high. There's a small study that was done of 8 patients, so very, very small. Again, this is very rare. But there was a study of 8 patients diagnosed at 14 weeks with a C-section scar ectopic pregnancy. And these patients decided expectant management, meaning they tried to go as long as possible to have term deliveries. 5 patients delivered between 29 and 36 weeks, 3 of whom were delivered via C-hist, meaning a cesarean hysterectomy, meaning they had a C-section and ultimately they had to have the uterus removed, which when you do that, very, very complicated, risky surgery, and you lose the ability to bear a child in the future because you're removing the entire uterus. And the remaining 3 patients of the 8 experienced a fetal demise, meaning their babies unfortunately didn't survive. So again, more research and more studies need to be done. How do we diagnose a C-section scar pregnancy? These are going to be diagnosed via ultrasound. That's why it's so important to establish care with your provider early on in the pregnancy, because in the first trimester, we can really look and see where the pregnancy has implanted and where the placenta is starting to develop. If you're diagnosed with this, then you meet with your provider, you meet with high-risk pregnancy doctors to determine what's going to be the best case scenario, what the survival rate is, either for you or the baby, and together you can make an informed decision of what you would like to do with your pregnancy. Now, oftentimes, if this is in the first or second trimester and you're coming in and the patient is hemodynamically unstable, meaning the patient is already experiencing a uterine rupture, then the next step would be surgery, because again, you can lose a lot of blood very quickly with ruptures. If the patient is stable, then that's when you sit and discuss with your patient what is going to be better, either continuing on in the pregnancy, a termination. You want to go over your options, and these are going to be really difficult conversations, but extremely important to have them. If choosing to continue on with the pregnancy is what you would like to do, this is what we call expectant management, and you are going to be followed very, very, very closely throughout the pregnancy. You would have a lot of visits with a high-risk pregnancy doctor or a maternal fetal medicine specialist. You would have multiple ultrasounds, early monitoring of the baby, and obviously be very, very educated on signs and symptoms of rupture, of bleeding, of anything feeling abnormal, because the morbidity and mortality of this is so high. If you were to make it past the 3rd trimester with these conditions, delivery is recommended between 34 and 36 weeks, likely more looking like 34 weeks, because the earlier you plan these is going to be better, and you want to plan them with multiple doctors in place, because oftentimes this is going to end in a cesarean hysterectomy. So the most important thing I want you to take away from this video is, one, a C-section scar ectopic pregnancy is extremely rare, so the chances of it happening are around 1%, maybe as high as 3%, but I really think we're looking more at 1% or less. And knowing that if you're diagnosed with this, you're going to need extensive counseling from a team of doctors to try and figure out what's going to be the best case scenario for you. So I hope this answered a bunch of the questions you may have had, or maybe you've never heard of a C-section scar ectopic pregnancy, because oftentimes when we talk about ectopic pregnancy, it usually is in the fallopian tube. And while that is still dangerous, it doesn't carry all of the same crazy risks or the rarity that we see with it implanting into the C-section scar. I hope you learned something new today. And if you have any other questions, leave them down below in the comments, and I'll see you in my next video. Bye!